Hello, I'm here to discuss with you the funding for Bill CS-SB 366, the Infectious Disease Elimination Act. The Infectious Disease Elimination Act, also known as IDEA, is a proposed bill in the state of Florida that offers the exchange of dirty needles and syringes for clean, sterile needles to intravenous drug users and other individuals to help prevent the spread of infectious diseases such as HIV and hepatitis C. Not only will this program help prevent the transmission of bloodborne infections, it will also supply the resources to those individuals who do not have access to health care, along with those who seek help to quit. The requirements for this program include the materials, security throughout the building, educational materials, on-site counseling and disease screening, and emergency medication for opioid overdose and reversal agents. This bill has been piloted in Miami-Dade County since 2016, and according to the Miami Herald, has already had more than 250,000 needles collected with over 1,000 participants. The amount of intravenous drug users continues to rise throughout the state of Florida, and with the rise comes infections related to intravenous drug use. While HIV and hepatitis C are diseases that can result from sharing dirty needles, bacterial infections are also acquired. These bacterial infections require hospital stay with strong antibiotics and are usually given over a 6-week period. According to the MMWR Morbidity and Mortality Weekly Reports, in 2015 in North Carolina, hospital costs for treating endocarditis and bloodstream infections in intravenous drug users was $22.2 million. Also, at Jackson Memorial in Miami, they found that in 2015, prior to the pilot of IDEA, there were 349 hospital admissions due to intravenous drug use and bloodborne infections, which resulted in $11.4 million. They also found that 92% of those hospital admissions were uninsured or on Medicaid. This program is designed to help eliminate the transmission of bloodborne infections and reduce the admission and eliminate costs-related infections caused by intravenous drug users requiring hospitalizations. During the pilot of Infectious Disease Elimination Act in Miami-Dade County, the program was privately funded. However, approval of this bill throughout Florida will require more funds. These funds will go towards the purchase of sterile needles and the disposal of contaminated items, security at the facility, and educational resources for those individuals wanting help to quit. IDEA will require public funding from the government to jumpstart this program. I am asking for funding from the Center for Disease Control and Prevention, the CDC, through the Prevention of Disease, Disability, and Death by Infectious Diseases grant. This federal grant provided by the CDC provides financial assistance to be used in the prevention or control of disease, disability, and/or death by infectious diseases. IDEA is designed to help decrease the spread of infection processes through exchanging dirty needles for sterile needles and syringes to intravenous drug users. Additional potential funding opportunities for IDEA will be provided by the Center for Medicare and Medicaid Services, CMS. If CMS was able to fund IDEA, they would financially benefit. With over 92% of the IDV users at Jackson Memorial being uninsured or on federal insurance, that means approximately $10.4 million was paid by the government, or not paid at all to the hospital. IDEA would help decrease the hospital admission rates by providing sterile needles, along with disease testing and prevention resources. If funding is provided by the CDC and the CMS, the state of Florida will be able to create an organization to help decrease the transmission of infectious diseases by intravenous drug users, which will in turn decrease the number of hospital admissions due to the spread of these bloodborne infections, along with the hospital costs to provide treatment. The Infectious Disease Elimination Act will be able to provide individuals with sterile needles and syringes, as well as access to health care and resources to aid in their recovery. Thank you.